Hello, my name is Cheryl and I will be your nurse. I will start off by getting to know my patient a little better, about asking if they're comfortable, if they need water or anything else that they might need before the surgery. And then I would start off by telling them what their surgery is. So in the case of my patient, I would tell them basal cell carcinoma is an abnormal uncontrolled growth that develops in the basal cells, which are in the deepest layer of the epidermis. And more often than not, they look like open sores, and they are caused by excess exposure to the sun. And almost 1 in 3 types of cancer are BCCs, and they're the most they're the cancers that occur the most often, and they're somewhat easy to remove just because they do not metastasize beyond the original point of origin, which makes it much easier to remove in comparison to other forms of cancer. Typically, the surgery is an outpatient procedure that starts early in the morning and is completed the same day, so about 1 to 3 hours, depending on the extent of the tumor and the amount of construction. Most patients receive local anesthesia around the site of origin, and they are awake for the entire procedure, and this is so it promotes a lengthy recovery, as well as prevents the side effects that general anesthesia would have on them. Also, the surgery is performed by their dermatologist, and it's generally removed using a scalpel or a curette, along with a thin layer of surrounding tissue. So they remove a small portion of it, and they place it under a microscope, and they check it to see if it's actually cancerous. And if it's cancerous, then they'll continue removing it, and they'll continue removing it until all the cancer cells have been taken out. In most cases, that's the case, but also if they look under a microscope and if it's not cancerous, then they'll usually allow the patient to go home, saying there's nothing they can do for him, because if it's not cancerous, they won't be able to take it out. And also, when the surgery is complete, a lot of people will look into plastic surgery in order to cover up their scarring. And also, after that, doctors will have a follow-up appointment just to see how the patient is doing about a week or two after the surgery, in order to see if everything's healed properly and in order to take the stitches out as well. So it's a very simple procedure, and it shouldn't take more than a few hours. In the best case scenario, which is what happens most of the time, you'll be allowed to go home and make a full recovery with minimal scarring, depending on the extent of your tumor. So I look forward to working with you.